When a person is sick in the family, I call it as the whole family gets sick with him. Neurosurgery is one thing where no one can come and then from a different specialty do something. You need to be specifically trained in that branch. I was witnessing the whole surgery. I was thinking, such a small baby, like 21 days. Like how you're going inside the spinal cord, you're correcting the deformity. We think it's easy when we see from outside, but even for the surgeon, how difficult it is and how many years of preparation is needed. Patients who get delayed attention or delayed medical attention, they don't do very well in brain, because success is happy. We can happily go and say everything went well, your child is good or your patient is good, but making a bad news is one of the most important thing, because anyone can come up and post anything about health. You don't need to have some kind of a degree or some kind of this thing for posting. You can come and say this food is good for you, go eat this. People will have so many likes. That is not good. If you take any successful people, for them to have a peaceful mind, sleep is the most important thing. Than exercise, than diet, than anything else, sleep is the most important thing. Because
Hello and welcome to the podcast. Today we are joined by Dr. K.V. Shivanand Reddy, a renowned neurosurgeon whose journey goes far beyond operation theatre. From performing life-saving surgeries to helping patients and families in their difficult time. His journey is not just about medicine, it's about humanity, it's about hope, and it's about purpose. Hello, Doctor. Welcome to the podcast.
Thank you for having me.
I hear that you saw one incident where a neurosurgeon was actually saving life of a soldier, and that turned your life and gave it a purpose. Tell us more about it and take us to the moment.
That was in my childhood. Like, I am from an army background. My father was an engineer, was a major in army. He was posted in Jammu and Kashmir. So, as my father being an engineer, he goes around the hospitals, the work and everything. So, he was very close with the doctors and all that. So, just I always wanted to go to the hospital, look around how it feels, and also he took me just one day. So, the neurosurgeon there who was posted, Colonel Shekhawat, I remember his name very well. He was very close to my dad. So, when we went into his cabin, then they told that he's attending a soldier, some bullet firing has happened nearby. So then after some time he came, then my dad was asking him like, what happened, doctor? And he was telling that there was a bullet inside the skull which was stuck there, so he had to go in, operate and remove the bullet. Then like I was around 13-14 years that time. We used to see the Rajnikant movies and all at that time, how the bullet passes, you hold it with the hand.
Yeah.
I thought something like that can happen. But that was the real world which I heard, that that's how we open up the brain. He was telling we'll cut the bone and then we open up the bone. It was very fascinating. Like something which you don't imagine, like something like this happens also. So that something has really stuck to me. Then after that, it was there in my mind for some time, and then going forward when I was thinking of becoming a doctor and all that, so that incident always stayed with me, like how something can be so life changing in a people's see, when you save something, no, it's not about the life of the only person, it is about the whole family. Or when a person is sick in the family, I call it as the whole family gets sick with him. Because it's not only the person, because so many people have to sacrifice things, so many people has to take care of him. So something which changes people's lives. I thought neurosurgery was that branch which can bring happiness to people. Like, it was a very nascent phase at that time, where the outcomes were very poor in neurosurgery. If you take 10 to 15 years from now back, the technology was not that developed, the outcomes were very poor. Even though we treat, we operate, the patients always used to have some kind of disability, they used to be bed bound, something like that. But now, over a period of next 10 to 15 years, it has largely developed very much, where the rates of disability to the patients have come down, the skills have improved, the techniques have improved. So it's for the good. Yeah.
Definitely. It's a very difficult branch of medicine. It's one thing as a 12, 15-year-old boy to think about, I want to become this. Everybody, I think, do that. And there's another thing of actually choosing it
Yeah.
when you're going for it. So, what made you keep making that decision, and what were your moments in during this whole journey?
Yeah. So see, to become a neurosurgeon, it takes 15 years to 18 years, depending on person to person, like how we start our MBBS journey from. So at each phase, we decide what we want to become next. During MBBS, you may like one branch, and once you choose, because after MBBS, we need to choose either you go into a medicine, you go towards the surgical side. So, but surgery was always my option. I was always fascinated towards surgery. I used to love blood. I used to see, used to love how bleeding is happening, and then it's being stopped, and how the patient is recovering. I was always very fascinated with that. And in that way, again, if you take every surgeon, once he is in his surgery phase, he is posted into different super specialties and all. Even at that time, I always chose neurosurgery because I felt it is something very different from other branch. There has been always some overlap in different branch. You take gastro, you take general surgery. There have always been few overlaps. But neurosurgery is one thing where no one can come and then from a different specialty do something. You need to be specifically trained in that branch. So in that way, it and yeah, there was one child when I was in my general surgery. My professor, Dr. Vasan, was there. He operated on a young kid, 21 days kid, with myelomeniingocele, because we call them as birth defects. This child will have some spinal birth defects and all. So I was witnessing the whole surgery. I was thinking, such a small baby, like 21 days, like how you're going inside the spinal cord, you're correcting the deformity, and means we think it's easy when we see from outside, but even for the surgeon, how difficult it is and how many years of preparation is needed to put a knife on a patient's body. It's very, very fascinating to know. It's very difficult job. It's not an easy job, because we always think that doctors don't have emotions or feelings. Doctors have a lot of emotions and feelings, because once the patient is doing good, we feel okay, happy, and we jump on to other. But once the patient is not doing good, and we are not able to give that much outcome which we wished, or because of maybe number of reasons, the next going on to the next patient becomes very difficult emotionally, because you always have that thing in mind, what could be done better, how could we have done this to the patient, given a better life or a better outcome to the patient. So in that way, it's a very difficult job, but over a period of so many years, I've learned to move on. Like, if you don't move on, you can't do your job properly. So you have to move on from patient to patient. It's a difficult journey.
What were your moments during this journey? What maybe would you like to share? Any incident which was hard for you?
Mine was, one thing was sure, I didn't wanted to do anything else. I wanted to do only neurosurgery. That I was very sure. And then when I got my residency seat in Nizam's Institute of Medical Sciences, it was only my second day. See, the pressure of an environment of neurosurgery is always emergency. And NIMS being one of the very prestigious institute with an extremely high patient load of neuro cases, it was my second day. Our seniors were posted. I was posted as a junior with them. We had a 6-year-old child with a severe head injury, and child was unconscious. Then my senior saw the patient along with me. I was helping with the scut work and all, and there was a huge bleed which was noticed in the CT scan. Then they told immediately we need to operate the child. I thought child was dead. To be very honest, I thought child will not make it. I don't know why, what are we exactly doing. So I know that we need to remove the bleed, but looking at the condition of the child, we thought, I personally thought that child will not survive. Then my seniors, my professors, all them took them to the surgery, operated within an hour. Child was out of surgery also, and next day child was opening his eyes.
Wow.
So it was a condition of EDH, what we call in neuro. But yeah, but in that day I understood one thing is time is very, very important in brain. The earliest you manage the injury, the outcome will be as good as we can't even expect. That's why patients who get delayed attention or delayed medical attention, they don't do very well in brain, because brain is a closed structure. So this all surrounded by bone. So when the pressure increases inside the brain, there is nowhere to go. So it affects all our vital structures and patients goes into coma. So that's why earliest we operate on brain, earliest, and the good will be the outcome. So that's the thing. When I learned that day is time is brain. I used to hear that, I used to listen to that when I was preparing and all, but that was the moment where I understood that time is brain and
Wow.
brain is time.
Yeah.
Yeah.
You mentioned about operating on infants and
Yeah.
newlyborns and
Yes.
very young kids.
Yeah.
Is there any difference between operating on any adult and on child? Is there any you feel
Yeah.
like bigger responsibility or
The difference is a lot. If you take even the anatomy or the surgical point also, it is a lot different. And it comes lot of emotional burden will be there on a doctor when he treats on a child, especially. Let it be any field, pediatric surgery or anything, the emotional burden is extreme. That too in neuro, because the hopes put by the parents and their family on a surgeon whom they are handing over their newborn are extremely high. So yeah, it makes you more extra responsible, but again the complications associated with it, the chances of patients developing or it going hayward is very high. So yeah, that extra burden is always there, but that's why we train ourselves. So
yeah,
that's why we
I
train.
wanted to
Yeah,
ask,
that's
yeah,
why
how
we
do you
train.
manage
See,
this?
so there are only two things in this world which are called as practice. Others are called jobs. Okay, it's one thing is medicine where we call it as practice. Another is an advocate or a lawyer where we
Advocate,
call
yeah.
practice. Because we practice every day. It is not that today I have done my MCH and I'm a neurosurgeon, I know everything. We learn every day. We practice every day. Every case teaches you something new. It need not be in the books. It's always the case which teaches you. So every surgery, even today, if I go before that, I read for some time, at least how much or little time, 5-10 minutes. You brush your knowledge. You find something new has come. You read about it. How much ever simple it is. How much ever thousands of times you would have done that surgery, but always make a effort to put that extra minute or to go into and putting knife on someone's body. It makes you more responsible.
And how
Yeah.
do you deal with the emotional part of it?
See, yeah, it is something which all the doctors have to deal with. It's not only about neurosurgery, it's about each doctor has to deal with. Breaking a bad news is the most difficult thing a doctor can anytime have in his life, because we need to keep our faces very serious and professional. Even though inside we understand it is an emotional moment for a patient, and going and telling him that your dear one and close one is very critical, or we are not able to save him, or it will be very difficult. It is a very difficult thing to do. It
It
comes
is,
again, it
yeah.
too comes with practice, because
Practice.
we keep ourselves in their position, and we hearing the same news, it's very devastating. So breaking bad news is one thing which is very very difficult for any doctor. Success is happy, we can happily go and say everything went well, your child is good or your patient is good, but making a bad news is one of the most important thing, because that is where the empathy comes into picture. How empathetic you are towards the patient, how good you are, and that gives the patient the confidence on you, because ultimately we are also humans. So we can do as much as a doctor has studied, practiced, or learnt, not more than that. So we need to be on an human basis at that moment with the patient. That's what I have learned over years, because I have patients whom I have lost under my care, but the same patient attender gets another patient, because he thinks that the doctor has put his 100% to save my patient, even though it has been out of his hands. So that emotional attachment, or that kind of confidence a doctor needs to give to their patients. That is the whole thing about it. It's very simple. The doctor patient relationship, which was there few years back, is not there now. It has been largely misinterpreted, or things have not been the same where what patients used to think before. But whatever it is, that's the ultimate thing. A trust a patient keeps on the doctor, which the doctor needs to stand for. That's the ultimate goal of any doctor if you take in this world.
Doctor, I hear that these days everybody is mentally uh, tired.
Hmm.
They feel tired all the time.
Hmm.
They have not done anything physically challenging.
Hmm.
Why does that happen? And what goes into the brain,
Hmm.
and how can we come out of it?
See, that's what. We have got so much of information in our palms these days that everything can be googled, everything can be overthought, everything can be misinterpreted. Okay? All these challenges, all these hardships were always there. They haven't changed. Survival of the fittest is there from so many years, hundreds of years. It's not that it has come newly in this era. It's only the knowledge of the people have increased. Now, if we work for 10 hours, we think, oh my god, so much of stress I have. See, that is what the nature is about. The work, you need to work. See, you
Yes.
need to work. It's you can't complain that I have work, I have so much of stress, I have difficulty in doing this. Everyone is replaceable. There is no one who is irreplaceable. So the problem these days is after working for some time, people think this is too much of work, and they think these words like depression, anxiety, stress, these all, believe me, all these have been always there. They are just being heard nowadays. If you take your grandparents, my grandparents, anyone in that age, they also had a lot of stress in their work. They also need to do according to their bosses. Everyone had issues in their life. But these days it has become little, because you always, people have lost that human relationship, to be honest. How many children do you see these days coming out of their house at 4 o'clock and 5 o'clock and playing together in a garden, or all are on phones? We call something called a bend neck syndrome. Okay, bend neck syndrome, like this. We go to some halls, function hall or something, you just go to the last seat and see, there will be 90% of the people whose neck will be like this. They will all be in their phones, they will be seeing the phones like this. Just take a click of that image. Everyone is busy in their own life. The point of, I have my friend by my side, let me talk to him, just keep my phone has become like an ornament now. We can't separate it from our body. That is really causing the issues to the brain. I'm telling you, being with people keep people happy. Just seeing something on the phone and just thinking about that reel or something like that and thinking that is the world is mainly causing the issues. People are very much influenced by those things. In our field, if you say, anyone can come up and post anything about health. Anyone. You don't need to have some kind of a degree or some kind of this thing for posting. You can come and say, this food is good for you, go eat this. People will have so many likes. So that is not good. So that is where the technology can be used in a good way or a bad way.
What does lack of sleep
Yeah.
actually changes the way we make
See,
decisions?
you would have heard people saying, I sleep only 4 hours or 5 hours and I work so much. That's not great.
I think
That's
Shah
not
Rukh Khan
good.
also sleeps 4 hours.
Whoever it is, that's not good, that's not great. If you take any successful people, for them to have a peaceful mind, sleep is the most important thing. Than exercise, than diet, than anything else, sleep is the most important thing, because there are so many hormonal changes which occur in the body during that time. There is so many things in the body which needs rest. That's why at least 6 hours of good sound sleep is
For
very much important.
everybody.
Anyone, for
Okay.
anyone, 6 hours of good sound sleep is definitely recommended. You don't do anything else but have some peaceful sleep. Don't scroll. You can't have your phone by the side of yours in the night and you
That
sleep
is
peacefully.
also
Try
another
and
problem.
avoid
Yeah.
keeping the phone there. Try and avoid keep it away 2 meters away so that you don't reach it. So these things in the present era they're practically difficult because we are all got used to it. But these are few things, if we change, get back to how we used to be before, that's a beautiful world.
So, just like you mentioned that anxiety, depression, it was always there.
Yeah, it
We
was
just
always there.
maybe did not know the name of it.
Yeah, we did not know it much.
Don't you think mentally tired behavior was also always there? We just did
No,
not
it's
know.
good. No, it's one way good that we are talking about it now.
Yes.
See, it's good that people are coming out and they're talking about it,
Hmm.
and they're having modes to take help.
Hmm.
That's very good. In one way, that is good. But complaining about it is not good. You
Only
need to-
complaining
yeah,
about it is
only
not
about it,
great.
You take help.
Hmm.
Everyone
Apart
has,
from
yeah.
controlling phone usage and
Hmm.
social media usage,
Yeah.
maybe, what else can somebody do to come out of this mentally tired zone?
See, best solution for anything is do what you like at least 1 hour in a day. Okay, I like to walk, or I like to cycle, or I like to play a musical instrument. Do that. Just take 40 minutes, 30 minutes of your day. Do what you like. Everyone has so much of pressure in life. You have family pressure, you have work pressure, you have travel time pressure, you have everything. But do what you like, at least for half an hour of your day. That half an hour of that day will keep you happy for the rest
Of the
23 and a
day.
half
Yeah.
hours. Understood?
That is true, yeah.
So try to spend most time with the people whom you like around. Work things are unavoidable, few things are unavoidable. So try to keep yourself happy, at least do something which you likes. In this era now, what has happened is so many hobbies everyone used to have. I also used to have so many hobbies, but because of the work and things, we don't do them much. We love them, but we don't do them.
I recently removed all my social media. I deactivated, and I got 2 hours in my day free.
Yeah.
And I was like, wow, I had so much time and I didn't know.
See, I won't say you need to get out completely of
Yeah.
the social media, because see, this is a digital
Yeah,
world. You
that-
need to accept
that
it.
was not sustainable.
Yeah, you need to be available. If you're not available in the digital world, it's not possible in the
Yeah.
present era. So it's good, but yeah, limit. Everything has a limitation. So don't make it your own world, complete world. You have social people around. Talk to people.
Yeah.
That is the best therapy. See, I used to, when we were children and all, we used to go to the ground. We used to see so many seniors and all sitting, laughing around.
Yeah.
These days, that sight is very rare. We don't see. Even the old people are on phones.
Yeah.
They also
That
have
is-
all the Instagram
yeah.
accounts, they have Facebook accounts.
And because they're more free, they're even
Yeah,
more
so it's
involved into all
accessible,
of
no? Data has
Yeah.
become so accessible. So,
Dr. B, see these days that focus levels are going down, and it is a new topic that everybody is concerned about, honestly.
Yeah.
Can there be some exercises, or how can we reverse that? How can we focus more?
see, the basic thing is, whenever these days what happens is we get so many thoughts at one time. We just can't concentrate on one thing going on, because so much is already going on in our lives.
Yeah.
So primary thing is meditation is something which we always suggest to, even we do. See, we are also humans.
Yeah.
We also get so much of stress, anxiety. When we go through those things, we think so much about the patient, or what is the next case next day, or how to go about and all. So meditation is something, at least 15 minutes a day or 30 minutes a day, which will keep your thoughts processed and keep you calm. That is one of the most important practice which everyone should do. Take some time out of your day and do that practice. That will help you to focus more. That will help you guide that this is what you are supposed to do, this is what my aim is. Or take day by day. Don't think too much forward. That's what we tell everyone. Don't think about 6 months from now on. Take each day today. Today is a fruitful day, tomorrow is a fruitful day. Think on that basis. That will help you in this present era to achieve your goals and stay calm in both the ways better. Instead of just overthinking what will happen tomorrow, what will happen after 2 months, it's not going to help anything. So in that way you keep yourself more focused towards your work, and be happy and love what you do. That's the most important thing. See, neurosurgery is very difficult. It's very time consuming. You don't have time for the families. There are instances where I have left my wife in a movie theater and gone for a surgery. So it happens. So that's what it demands from you. Once you love your job, you won't feel it as stressful or sacrifice. There is no sacrifice. This is what we chose for ourselves. If I want to be an engineer, I want to be a best software engineer, this is what I chose for myself. No one has pushed into me. So love what you do. You won't feel anything stressful, anything difficult, or because it's your day-to-day life. So
That's very true.
Statement, a broader thing is love your life. Only once you will get. Use that
That
time
is
which you
true.
have very well. You can't reverse something in this world is time. It can't be reversed. You can't be reverse aged. So love what you're doing. Have a good time with people around. Enjoy your life. Don't take everything to the heart. You will live longer and you will live happier. Yeah.
That is very true.
Yeah.
What is one message you would like to give to future doctors and people who are aiming to become neurosurgeon and pursue medicine?
See, this is very common these days. Whenever someone asks me, sir, I want to become a doctor, we say no.
Okay.
Even in my family, someone asks me, I want to become like you, and I say, no, don't become, because it's not worth it. You put so much of time, so much of effort, so much of sacrifice. See, people think doctors make a lot of money. Okay, I'll be very open and honest. That is what people think.
Yeah.
Doctors make so much of money. It's so easy to earn money if you become a doctor. It's not easy. If you want to make money, don't become a doctor. For the efforts, for the sacrifices, for the time, it takes 14 to 15 years to become a good doctor. Understood? Your whole young life from 17 to your most productive 32, 33 goes into studying a branch which you want to become. You love it, definitely do it. You want to become the best in that, do it. Don't do it thinking I'll get a lot of money, I'll become this, no. Because as any other field, this also has got a lot of competition. There are, every day you need to improve your knowledge. Every day you need to learn new things. So it's not a one day job that you finish a degree and you're done. So it's till the time you die. You need to keep practicing the skills. You need to keep studying. You have that in you, definitely become a good doctor. Help people in your ability. But if it is only money, if it's only some social status, those are not these days where people used to say you are gods. We are not gods. Those days are not there now. So if you save a life, we are a god. If we not able to save a life, you are not god. You are a devil. There are days where we have faced those situations. So it is not worth it. But if you love it, you want to put your 100%, 1000% into the science and do something good to the people, definitely do it and be prepared. Don't think anything will come easy. Nothing is easy. It's a long journey. It's a hard journey. And neurosurgery itself is very demanding. And be emotionally strong. And tell your family you will have very less time. That is one thing.
Perhaps
Yeah.
little more positive about being a doctor.
Yeah.
Something
This
more
is the reality.
positive.
It is, see, that's what. Ultimately, the satisfaction you get. I told you, no. Tonight, if I operate a patient, tomorrow morning I see him opening his eyes. That satisfaction you will not get if you give me $1 million. That is one thing which every doctor strives for. Believe me, that is the one every doctor in this world lives for. Your patient being happy, coming into your chamber and saying, thank you, doctor. That is one thing which every doctor wants to listen every day. So more than money, more than fame, more than anything is the satisfaction what the patient is having from your hard work. That is what you have put in so many years of your life into to save someone's life. So that's the most important feeling and the most important thing also. Patient first.
Patient first.
Yeah.
Yes. Thank you so much for
Yeah.
speaking with us and sharing your life journey, your learnings, and your advice. It's my pleasure to hear you, and
Thank you.
I'm sure it's a pleasure for our audience as well to hear you. What I understood from this conversation is human connection is very important for your brain, for your heart, and for your health. Don't underestimate it. Brain is very important. If there's brain, there's body, as doctor said. Take care of it. Hope to see you soon.